Assalamu alaikum wa rahmatullahi wa barakatuh. This is a new series, just like we've promised. We'll be bringing up health information management discussions so that people, students of health information management, can learn better, can understand what actually the course is all about. So today, Alhamdulillah, we together with Dr. Umar Farouk. For those of us who knows him, he's an icon worthy of emulating, and somebody who is also a role model to a lot of people, a lot of students of health information management. So we have invited him today so that he can tell us more about health information management practices and even the profession in general. You're welcome, sir.
Thank you very much.
Yeah.
Thank you for having me.
Sir, we have some questions, pre-designed questions that we want to ask you. I will hand over the mic as we proceed this interview, sir. All right, sir. We have a lot of issues regarding, especially in Nigeria, students of health information management find it difficult to understand what role health information management plays in healthcare delivery. So, sir, with your experience in this profession, you have a PhD in this profession, you have your MSc, even in abroad, in Kingston University. I'm very sure that you've seen a lot of HIM practices at that level. So, sir, we want you to share more light to us regarding, in respect to the role of health information management in healthcare delivery, so that the students studying this course will actually have the confidence and understand that they are not actually studying a course that has to do with just card issuing. Thank you very much, sir.
Thank you very much. Health information management is one of the key partners as far as healthcare delivery is concerned. The health information practitioners are members of team. You know, in healthcare we have a team, just like a football team. You know, one person cannot score a goal. It's a teamwork. So that's also what's happening in the hospital setup. We have team players, which consist of various professions that makes up a hospital community. We have the doctors, we have the nurses, we have the health information officers, we have the medical laboratory scientists, we have all other professionals, nursing, etc. Because collectively, their own role and responsibilities are part of what will bring the required service delivery to patients. So health information managers are also doing their own part by creating in the first place about the identification data, of course, maintaining the clinical documentation does by the doctors. They maintain a proper custody so that whenever the information is being required for continuation of care, for treatment, for research, they become available. So they don't only keep those records of information, they also maintain confidentiality of those information so that the patient's information is being kept at a very secured and secret kind of atmosphere, because the patient has given a trust to the hospital community, the hospital professionals. So those trust, based on the information he issued out, must be maintained with secrecy, and it must not be divulged or disseminated to any other person except with the consent of the patient, or except when those information will be used for the purpose of care of that particular patient or research. So that's when you use it without even a kind of consent of the patient. But in so certain situation, there's a body within the hospital that approve your use of those documents. So even if you are a medical doctor, you don't have to use patient information anyhow. No, when you want to make use of patient information, you have to put a proposal of the research you want to do then the committee, ethical committee, will look at that request and now approve and even give you an instruction to maintain a confidentiality. But you can use it during the time of treatment of the patient. But after the treatment, the case notes or case folders are retrieved for proper custody in order to maintain that confidentiality requirement for patients' sake.
So if I actually understand, and also those watching us live, the HIM professional or the health information management professional tends to be like a custodian of the patient's records. If I get you right?
Yes, actually, because he is trained to maintain confidentiality of the health information. Why is it necessary to maintain this confidentiality? Because actually, by communicating with the patient, you are only privileged to communicate. That's what we call privileged communication. You are just privileged to communicate with the patient. And that privileged communication also gives you the right or the chance to obtain privileged information. So that privileged information is given based on professional confidence which the patient gives out. Because he has a professional confidence in you that whatsoever information he issued out to you, you're going to maintain it very secret and confidential. So that's the reason why even some information he has not given it to his father or to his wife or her husband, etc., he will give out to you because you are a professional, so you are only privileged. So if you are given that trust, definitely that information must be maintained as secret as it should be. After all, the patient has some rights which is granted to him by the Constitution of the Federal Republic of Nigeria, if we are talking about Nigeria, and any other constitution of any other country. That is right to privacy. So every patient has the right for his private life. A right to privacy means right to be left alone. So you don't have to, disseminate information about a patient because it might subject him to societal ridicule. He might be looked down. He might be humiliated. He might be succumbed. That may cause him some psychological damage. Therefore, except in some certain situation of infections spread or emergencies or infection or global or pandemic, I can say then there is a procedure where that information can be reported for public health action. But that's why it's because the public interest, it has to override the desire to keep a secret of a single patient, because the public interest is what matters. That if it should be done, it must be done with respect to the patient, because patient is a special person which his interest and rights must be safeguarded at all times.
Thank you very much, sir. You made mention of the rights of professionalism or patients within our Nigerian system, which also leads us to the second question. It says, what is the journey so far about the development of HIM practices in Nigeria?
Well, health information management practices has been there for ages. It's often said that the development of medical records was the same as the development of medicine itself. Because even during the Stone Age, so during the time of Hippocrates, who was the father of medicine, who initiated medicine, he also kept records. There was evidence of records recorded in the paperbacks, at the back of tree. That you remove portion the cover fiber of the tree, then you write on it. So and he was doing it himself. So that shows the requirement for keeping medical records. And as time goes on, these duties and responsibilities was apportioned, because you cannot be a clinician at the same time be keeping records and at the same time be doing laboratory investigation and at the same time be doing the nursing work. So health information therefore emanated from medical records, When you say medical records, you are just changing it to clinical setup of